Can bad posture cause shoulder pain? Bad posture absolutely can cause shoulder pain. In fact, it's one of the most common causes of shoulder pain. I'm Dr. Dave Candy, and in this video, I'm going to tell you about 7 different ways, in fact, that bad posture can cause shoulder pain, as well as some postural tips that you can use to improve your posture and prevent shoulder pain. Now, when many people think of bad posture, they think of the typical forward head, rounded shoulders posture. And that is bad posture, and it's a fairly common bad posture, but that's a massive oversimplification. And that's one of the reasons why physical therapy programs that focus just on improving your posture and shoulders back and chin down, they work for some people, but they don't work for everyone with shoulder pain, because if that's your particular postural problem that's causing your shoulder pain, then it works great for you. But if that's not your problem, then it doesn't work so great for you. So I'm going to break down 7 different postural things that can cause shoulder pain. And those are going to be 4 things having to do with your shoulder blades, 2 things having to do with your arms, and then 1 thing having to do with your neck. So before we get into this, it's probably good to review some terminology with the way that the shoulder blades move and some of the anatomy related to it, because I'll be using some of these terms later on in the video. So your shoulder blades, they normally sit on your rib cage, and they don't sit right like this. They are rounded just a little bit in contour with the rib cage itself. So it's not normal to have your shoulder blades pulled all the way back the way that many people say. That there should be a slight rounding forward of your shoulder blades, about 30 degrees in front of the kind of horizontal plane this way, or the frontal plane in anatomical terms. So you should actually be a little bit in front of complete sideways. So that's one thing that you should know just starting out. Now, the shoulder blades can move in a lot of different ways. They can move translationally, upward and downward, or elevation going up and depression going down. They can rotate upwardly, where your arms move up that way, and they can rotate downwardly, like that. They can move away from your spine, and they can move towards your spine. And they can also twist inwards and outwards like that. So those are some of the terminologies that I'm going to be using referring to the shoulder blades. So one of the problems that can cause shoulder pain is the typical rounded shoulders posture, but that's really made up of 2 different component motions. One of those is internal rotation of the scapula, meaning coming this way, where your shoulder blades kind of flare in the back and they come closer together in the front. Then it's also combined with anterior tilt of the scapula, where the front part of the shoulder blades comes forward and the back part of the shoulder blades comes off the rib cage a little bit. So when you combine both of those, they look kind of like this. But not everybody has both internal rotation and forward tilting of the scapula. And sometimes fixing, just pulling your shoulder blades back like that doesn't fix both of those problems. That when you have an internal rotation problem, you want to kind of squeeze your shoulder blades back together. So kind of pinching the shoulder blades back together. And that's a common tip that people give in physical therapy, because it is one of the more common problems. But a lot of people, when they pull their shoulder blades back together, they pull them back like that. Now, a problem that creates is it actually kind of tips your shoulder blades forwards. So if you're focusing on squeezing your shoulder blades back together like that and pulling your arms back that way, it tips your shoulder blades forward. And if you happen to have shoulder pain due to a forward tipping problem of your shoulder, then it's not going to fix the problem. Now, the reason that rounded shoulder posture can cause shoulder pain is because as you raise your arm up and the ball of your shoulder kind of rolls upwards. And as you raise up, if the shoulder socket can't come upwards and backwards, then you end up pinching the rotator cuff tendons underneath the arch of the shoulder, and that can give you shoulder impingement syndrome, or it can be a cause of shoulder pain. Impingement just basically means that you're pinching the tendons. So if you have a forward tipping problem of your shoulder, you want to raise the arches of the shoulder raise the shoulder blades up like that, so that as you're raising your arm up, the shoulder blade can tilt backwards like that, and you don't end up pinching or impinging the rotator cuff tendons. Now, a postural tip that you'd use to correct that is thinking about chest up. But you should have a little bit of rounding in your thoracic spine, so you don't want complete military straight posture either. That can create other upper back problems. So you don't want to go completely upright like that. Instead, just think about kind of lifting your chest and shoulders and pulling your shoulder blades just slightly back towards your bottom. Now, if you got the other problem, the internal rotation problem, you do want to squeeze your shoulder blades together in the back. But you don't want to do that by pulling your elbows behind you, because again, that creates a little bit of a forward tipping of your shoulder blades. So instead, you want to think about kind of squeezing the shoulder blades together in a motion like that, almost as if you were raising your arms out to the side. And that's actually one exercise that's really good for people with shoulder problems, is bringing the arms out kind of like a W and sliding up that way, whether you're just doing it freestanding or standing with your back up against a wall or a door or something like that. So that's the first problem. That rounded shoulders posture that everyone talks about is actually kind of made up of two component motions. Now, the rest of the postural tips really don't have too much to do with that posture at all. So if the rounded shoulders posture isn't the thing that's causing your shoulder pain, then typical programs that just focus on correcting that probably aren't going to help you. So I mentioned some other movements of the shoulder blades, and those are elevation, moving up, and depression. So if one shoulder is too high, either from just leaning on things or maybe holding a phone up against your neck like that, just postural habits that you get in, perhaps sleeping on one side with a low pillow where your head's tilted over that way and it makes the muscles on this side of your neck stiff. All of those can contribute to one shoulder blade being held higher. Some people carry their stress in their shoulders as well, and that can also make you hold your shoulders higher. A lot of times that'll be bilateral, where you'll end up holding both of them a little higher if that's the case, but not always. Sometimes it's just one. Now, typically the shoulder blade should sit between the second and the seventh thoracic vertebrae, or T2 and T7. Now, there's some individual differences between person to person. It's not that way for everybody, but if that happens to be your symptomatic side that you're having pain on, and there's some variance from normal, and particularly if it's different from the other side, then that might be something that's contributing to your shoulder pain. So if you have an elevated shoulder like that, it can cause stiffness or pain in the muscles on the top of the shoulders. Additionally, if you do have a torn rotator cuff, or even just a really weak rotator cuff, but most commonly with a rotator cuff tear, you'll see people kind of compensate by doing a movement like that, where they use their upper trapezius muscle as a compensation for a weak rotator cuff, because if they can't move here very well, they tend to try to get a little bit more by moving there. So a stiff muscle in your shoulder can be a primary cause of shoulder pain, and particularly shoulder pain that's kind of in your neck or on the top of your shoulder right there. It can also be a secondary problem as a compensation for a torn rotator cuff. Now, just the opposite of that, scapular depression, where one shoulder blade is down lower than the other one, that can also create shoulder pain. And if one shoulder blade's sitting down lower, then as you raise your arm up, again, that shoulder blade, it can't rotate upwards as you raise your arm up. And so you can end up pinching tendons underneath the arch of the shoulder as you raise your arm. So it's really important to be able to get that arm or shoulder blade to raise up as you raise your arm. Now, what can cause that type of posture? Well, if you always carry heavy things in one hand, for example, a briefcase, or if you carry a heavy purse over that shoulder, that can be a cause. So avoiding carrying heavy things on one side exclusively can be one way to fix that. It can also just be habits of how you lean your body. Sometimes a scoliosis can create that in your spine, where it causes one arm to hang down lower and the other arm to be up a little bit higher. And those can both create problems where your shoulder blade just doesn't rotate upwards enough as you raise your arm. So some tips that you can use to prevent or to help with that are just supporting your elbow. If you're sitting, supporting it on an armrest of a chair, on a pillow, on a desk. If you happen to be standing, just put it in your pocket, or if you don't have pockets, kind of put it in, tuck it in your belt loop or under your pant or something like that. Or you can even just support it with the opposite arm. And all of those keep you from pulling down like that, pulling tension on the neck and the brachial plexus, the bundle of nerves that runs through your shoulder. And it also helps keep your muscles up here from being overstretched so that they adaptively shorten and get back to more of the natural length that they should be. So those are tips for both the elevation of your shoulder blades and then opposite, the depression of your shoulder blades. Now, the final thing that I want to go over with shoulder blade syndromes are the downward rotation of your shoulders. And I kind of touched on this a little bit, that as you raise your arm up, the shoulder needs to be able to upwardly rotate like that. You can commonly see that downward rotation of the scapula linked with a scapular depression syndrome because it doesn't rotate up enough. But you can also see that same problem if you've got a stiff muscle in the back of your neck right there. It runs up this way. It's called your levator scapula. And that can both elevate your shoulder blade as well as downwardly rotate it. So that scapular upward rotation, or lack of scapular upward rotation, doesn't necessarily happen just with a depression or just with an elevation. It can happen with either or neither. It can just be the primary problem. Now again, I mentioned some people pulling their shoulder blades back or trying to focus on squeezing their shoulders back like that. And when you do that to excess, it actually causes stiffness of your rhomboids, these muscles between the shoulder blades there. And they're actually downward rotators of the shoulder blades as well. So if you're focusing excessively on squeezing your shoulder blades back, but you happen to have a shoulder upward rotation problem or a lack of that shoulder upward rotation, then squeezing your shoulder blades back may actually be harming you rather than helping you. So that's why a one-size-fits-all approach doesn't work when you're trying to treat shoulder pain. So those are the scapular problems. Now, what about the actual arm itself? There are two main problems with the arm that I see, and a third problem, but the two main ones are really that the shoulder is too far forward in the socket, or that it's twisted too far inwards. Now, if you happen to have a rotator cuff tear, sometimes the ball of the shoulder rides too high in the socket as well, but we're not going to cover that one in as much detail in this video. So the first one, and this is the most common one, the ball of the shoulder glides too far forward in the socket. Now, how would that happen? One really common way is if you tend to put your elbows behind your body a lot. If you stand with your shoulder blades pulled back with your elbows behind your body like that, or trying to squeeze your shoulder blades back that way, doing a lot of rows at the gym like that, when your elbow goes really far behind your back, the ball of the shoulder kind of glides forward in the socket. Reaching in the back seat, that's another way that can cause it. So one really easy thing you can do to prevent that from happening is just focusing on keeping your elbows at or slightly in front of the plane of your body. Now, if you happen to have a forward tipping of your shoulder blades, that is often associated with that forward glide of the shoulder, because when you tip your shoulders forward, your elbows tend to go back. And so those two problems can occur together. They can also occur independently of one another. The second problem is too much rotation that way of the arm. When you raise your arm up with a thumb down motion, that brings a bump on the ball of the shoulder called the greater tuberosity. It kind of brings it underneath the arch of the shoulder, so you end up pinching tendons. And so if you tend to reach up like this with your thumb down, you'll pinch tendons underneath the shoulder. And a really simple fix for problems like that, if that internal rotation is the cause of your shoulder blade, or is the cause of your shoulder pain, is just to reach with the thumbs up. So instead of reaching for something like that, reach like that. If you have to reach into a high shelf and grab something, reach with your thumb up, then turn your hand, rather than reaching straight out like that. That'll prevent that internal rotation of the shoulder and help you to relieve your shoulder pain. Now, when you're sitting, you also want to kind of focus on keeping your arms sort of in this plane, not with your elbows flared out to the side. If you look from the back, you can see the elbows are out that way. You want the elbows kind of to be in a straight forward and back plane. So those are the 4 shoulder blade things, and then the 2 postural symptoms related to the arm. The last one is related to your neck, because the C4 and the C5 nerve roots in your neck, they actually refer pain down to your shoulder, and they can be a cause of shoulder pain. And many people that I see who think they have a shoulder problem or a rotator cuff problem actually have pain that's being referred from their neck. Now, even if the pain isn't being referred from the C4 and C5 nerves in your neck, if you have mild irritations of those nerves, it can create weakness of your rotator cuff muscles or weakness of the muscles that move your shoulder blade, and they can cause secondary problems like shoulder impingement or pinching the rotator cuff tendons. So it's really important to rule out neck involvement in any type of shoulder problem. And so the classic forward head, that probably is the most common postural problem that applies to the neck in regards to shoulder pain. So if you sit with a forward head, what that actually is the flexion or moving downwards like that at the lower neck combined with an extension at the upper neck. And if you're doing that type of motion, it creates a lot of pinching right in the middle part of the neck, right around the C4, C5 area where those nerves to your shoulders come out. So an easy tip to solve that is just to keep your head above your shoulders, chin slightly down. You don't need to go massively chicken neck like that. That's an overcorrection, and that's not good either, because you should have some curve in your neck. It shouldn't be completely straight up and down. But instead of sitting with your head forward and chin out like that, just think about ears over shoulders, chin slightly down. If it feels like you're straining or struggling to do it, you're probably trying too hard. Just making little postural corrections like that over time. Don't focus on coming way back and holding it. Just head over shoulders, chin slightly down. It'll get easier over time, and you'll get into a more correct posture over the course of weeks and months. That problem didn't get there overnight, and it's not going to go away overnight. But if you make small steps in the right direction, it'll help you address postural problems associated with your neck and prevent neck pain or shoulder pain that's associated with your neck. So those are the 7 postural tips that you can use to improve your shoulder pain. Now, with everything I've gone over in this, you might be a little bit overwhelmed, and that's okay. I didn't even understand all this stuff when I came out of physical therapy school after 3 years of physical therapy school and 2 years of athletic training before that. And a lot of physical therapists even get confused by this. So if you're feeling a little bit overwhelmed, that is okay. You can always rewatch this video, reread the blog post. But a lot of times it's easier and less frustrating just to find an expert who understands the problem and to get it explained to you and help get you pointed in the right direction. If you think about building a deck, if I got the blueprints, I could probably go to the hardware store and build a deck in my backyard, and it would take me a long time, but I could probably get the job done. Still might not look the greatest, but I would have done it myself. Alternatively, if I had hired a contractor, it would probably get done in less than half the time, and it would probably look a whole lot better at the end as well. So if you do need some help for your shoulder pain, I encourage you to reach out to someone who understands it. If you happen to be in St. Louis, then we'd be happy to help you out at More for Life. Just contact us through our website or give us a call, and we'll get you scheduled for an appointment. And if you're watching this from somewhere else, but it gave you some more clarity and understanding of your shoulder problem, then give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and have a great day.